Good morning, everybody. My name's Georgie Harman. I'm the CEO of Beyond Blue, and days like today make me incredibly happy. They make me incredibly happy because I've just left wintry Melbourne, and my EA had the foresight to put me on a plane last night so that I avoided the Melbourne fog, which apparently is like a blanket this morning. But it's delightful to be in the warmth and in sunny Brisbane, which is one of my favourite places. So it's a delight to be here. It's also a very happy day because today we're officially launching a fantastic new service for the people of Brisbane North. We've got some fantastic guest speakers lined up, some very important people who I will introduce to you in a second. But it's a very important day for Beyond Blue because it sees us bring to life a project that we've been germinating for the last 7 years. A program that actually provides very, very practical early support for people experiencing a mental health problem. And it provides them with really practical advice and skills for life that really helps them in their recovery and maintaining that recovery. I'd just like to briefly acknowledge our VIP guests. Firstly, Songwoman Marucci, who's about to welcome us to country. Mr. Trevor Evans, the member for Brisbane. Jennifer Power, the acting CEO of the Mental Illness Fellowship of Queensland. Pauline Coffey, the executive manager for mental health, alcohol and other drugs in Brisbane North PHN. And Ivan Frakovic, did I pronounce this? Very good. The Queensland Mental Health Commissioner, and congratulations on your appointment, Ivan. But also 3 other special guests, Dana, Julie and Tabitha, who are the 3 fantastic new access coaches that are working in this great new service that we're about to celebrate. But before we get into the official proceedings, I'd like to welcome and introduce to you Songwoman Marucci, who's the first Indigenous Australian to perform on the Australian operatic stage. In 1993, she became the first Australian to perform for the United Nations in New York to mark the International Year of World's Indigenous People. And Songwoman Marucci will perform a traditional blessing of this gathering in accordance with the Turrbal traditional laws and customs. I've also asked Marucci to talk to us about her cloak, which is the most magnificent thing I've seen in many a time. And you said that you didn't want this to be about you, but I think it's really incumbent on us to ask you to tell us about this beautiful garment that you're wearing. So please join me in welcoming Songwoman Marucci.
Dagatin Australian Naba Yugari Murumbaga Da Kolamai Kiberndangaleyu Biki Numbai Kita Milin Murumba Bulkari Yadani Australia Boo Taganurunale Kiyua Yadani Australia Balamdiko Gundunumbaler Balamdiko Gundunumbaler Yang Indai Yango Gundai Yango Balamdiko Gundunumbaler Balamdiko Gundunumbaler Bukairi Marumba Barambanu, because this whole valley is called Baramban. Baramban's place of where the wind blows. It's one of the places on the songline, of the wind songline. My last name Baramba is also on the wind songline. There are many stories associated with that. I'm here representing the Turrbal people, as already mentioned. I'd also like to acknowledge the dignitaries in the room, as well as all fellow Australians, because the very important work you do in health. We have that problem, I suppose, in our community. I think, I won't go into that. So, my cloak. My cloak is Marucci, that's my totem. Okay? Within Aboriginal societies, you have structures within them. They call them systems, moiety systems. Some states, like my grandmother's Gamilaroi, they have 4 classes within the Gamilaroi thing, but here in southeastern Queensland, Gamilaroi is out St George, Moree, all those places. But here in where my grandfather's people comes from, the whole of southeastern Queensland, we belong to one big kinship system. The kinships, the geographics of that area is from south of the Tropic of Capricorn, east of the Great Divide and north of the McPherson Ranges. Within those two systems, you have Dilbys and Cooperthin, the two structures that come down. Up on Dalby actually got its name from Dilby, it's anglicised, like my name Maroochy is really Murakuchin, but that's also been a little bit anglicised for people to pronounce, I suppose. I suppose there's a lot of places like that. Within each side you have 3 levels of totemic identities, and it's a generational thing that rotates, and you're only allowed to traditionally cross when you marry. To cross, you're not allowed to marry on those. When I talk those levels, that's that, where the totems are, what animals your totems are, or plants also. That's it. So my name Maroochy is Black Swan. And that's why I paint my face like the swan, because of the red and the white. Maroochydore has gotten its name from the Aboriginal name, but also many people say to me, oh, I thought it was only West Australia that had swans. It was all over, especially East Coast and West Australia. In fact, Matthew Flinders, when he was here, he came in 1799, collected a few swans from the Palmerston Passage where they dropped anchor up there to take back to England. So there's probably, if they preserved them all these years, some dead species in museums over there. So I'll do the blessing of the gathering. Thanks for having us. Wish you all the best in the future. I know the work you do is among the most important within society. Mental illness, I suppose, affects many, many people on different levels, and we all, like even me, I walk around real nervous sometimes. People say, you shake too much sometimes. But, I always put it on the fact that the morning I was born, my mum threw a crazy ram, threw herself down the flight because she was having which is Aboriginal behaviour, showing pain to yourself, because she was having an argument with somebody else, so I popped out. Feet first, that was it. So I came when I was a little bit before, maybe I was too eager to get out, before I was supposed to. So I'll do the blessing. And Manda Baritha, Muriana Men, Manda Baritha, Muriana Men, Manda Baritha, Muriana Men, Bithalgari Astoy, Gavaikari Budja. Manda Baritha, Muriana Men, Manda Baritha, Muriana Men, Ngaido Payawa, Nyin Yunganala, Manda Baritha, Muriana Men. Manda Baritha, Muriana Men, Manda Baritha, Muriana Men, Garinanami, Chuchimobironu, Garinanami.
Thank you so much. Thank you for sharing your story, and thank you for that very warm welcome and blessing. We really appreciate it. Thank you. So what is New Access? New Access is a service that I said earlier, we've spent at Beyond Blue 7 years researching, developing, trialling in the real world. It's an Australian first that we believe can potentially revolutionise the way we approach early intervention in mental health support. It's a service that reaches people regardless of the town that they live in or how much money they have in their bank account. It's free, and thanks to this fantastic new partnership, it's available to anyone aged 18 years and over in the Brisbane North region. People can come to the service in person. If they prefer, they can see their coach over the phone, or they can actually use smartphone apps like FaceTime and Skype. So we're putting New Access support in people's back pockets. You don't need a doctor's note to get into New Access. There are no waiting lists in that sense. Each person works really closely with their individual coach, who really helps them identify what the issues are that are going on in their life and how they're feeling, why they're feeling that way, and ways to manage and to recover. It's a low intensity treatment, so it's extremely cost effective. There is no diagnosis, there are no labels. The results of our 3-year trial saw over 70% of participants recover, which is just quite extraordinary. And our trial period also saw 40% of total participants identify as men or male, which again is significant. We know it works. It smashes every single everyday barrier that prevents people from seeking mental health support early. Cost, difficulty accessing services, and stigma. So today, 2 local organisations are showing tremendous leadership and vision as they partner to ensure New Access is an ongoing service that's available to people early and who need it the most. I'd like to acknowledge the Mental Illness Fellowship of Queensland and the Brisbane North PHN for showing such dynamic and proactive leadership. You're leading the way, and we're very, very pleased to support you in your journey. So here now to officially launch New Access, I'm delighted to welcome your local member, Trevor. So Trevor is one of the youngest MPs in our Federal House of Representatives. We'll knock that out of him shortly, I'm sure. He'll in 2 years' time, he'll be haggard. He's incredibly passionate about his local community. He comes from a business family. He's actually an economist. He used to head up the National Retail Association, and he's a strong advocate for jobs, innovation, and the economy. And I think one of the things that I've seen throughout the pilot of New Access is that it keeps people connected to good work. So you may have some thoughts on that, Trevor, but please welcome Trevor up here to officially launch New Access.
Well, thank you very much for those kind words, Georgie, and I promise that Brisbane's always like this. So you should join us far more often. Can I start my short speech today by adding my acknowledgements to the traditional owners of the land and paying my respects to the elders of the Turrbal people. Marucci, you always give a fantastic show. You're unparalleled and unforgettable, as always. And just in passing and by way of comment, you've probably heard this before, but the reason that Matthew Flinders and others were so keen to send black swans back to the UK and to Europe is that until that time, the Europeans did not know what was very well known to the traditional owners of our land, which is that swans came in the colour black. Europeans and people in the Northern Hemisphere had only ever seen swans which were white before. And so there was previously a saying, a metaphor along the lines of black swans being an impossibility, as something that couldn't possibly exist. It would be like us discovering somewhere in the universe today that there was such a thing as flying pigs, which is why they were so keen and so interested in the black swan, which is just so totemic for Australians and not just Western Australians. Can I say how pleased I am to be back here at MIFQ? You guys do absolutely fantastic work. I've been here before and we really appreciate everything that you do. And can I say how proud I am to be part of a government which is recognising that sometimes to make real changes, it's all about people coming together and partnering and collaborating. Here we have a partnership of some of the most effective and well-known partners that we could possibly have in the mental health space. I want to say a few words about the Brisbane North PHN, because I hear everywhere that I go that the Brisbane North PHN is the very best around the country. I hear that repeatedly. So you have a very strong and good partner there, and Beyond Blue, of course, is unparalleled in terms of the work that you do. Your reputation precedes you, and we have great confidence knowing working with your programs means working with the very best. I just wanted to make another observation. As Georgie said, I am a relatively new MP. Nonetheless, I come into this role with a little bit of experience in different reform journeys, and it seems to me that the reform journeys, solving problems, comes in a couple of waves. The first wave is always around taking something out from underneath the carpet, something that's been hidden for too long, elevating something into the national conversation. That happened with mental illness and mental health a few years ago, and it's been a fantastic journey since then. It's where I suppose issues like domestic violence and veterans' mental health probably is right here today. The next stage in that journey is usually after something gains prominence in the national conversation, people start to nod their head and they start to say, yes, it's time that we did more about that. And what you tend to find is that governments respond by putting resources, funding behind different things. And we're in the stage, I think, at the moment where we're starting to try to improve, to perfect on the early learnings that we've had and to better direct the resources, to try new things and not to be afraid to innovate, to invent, to make some mistakes possibly, to learn from them and to move on. I'm very pleased that the federal government, through the Brisbane North PHN, has been able to allocate some significant funding to make this happen. And I'm not ashamed of the fact that it's come through a review from the National Mental Health Commission that looked into what services and what programs there were and asked some of those big questions about what is the next stage, how can we make things better. So I'm really, really happy to be part of launching this program. I wanted to say, for the coaches who I met earlier, I meant what I said. Everybody in this room wants you to succeed. And so we are willing you so strongly. We know you're going to do great work on behalf of our community. If you ever hit any road bumps, any turbulence, any big questions, look around you. Everyone in this room at the moment is there for you to call on. This is a collaboration. This is a partnership. We're all in this together. So that's probably enough for me. All I will say is, without further ado, I hereby launch the Brisbane North New Access Program. Thanks, everyone.
Thank you, Trevor. That's a wonderful, very warm welcome. And we joked earlier about him smashing a bottle of champagne over my head, but we might do that later. MIFQ is an organisation that I've had a great deal of admiration for many years. Their vision is, I think, just a beautiful reflection of what we all feel, that people affected by mental illness live the life of their choice. They're accepted and valued by the community. And their families and carers are supported and validated too. And I think that just really encapsulates the spirit of MIFQ as I've come to know you. So it gives me great pleasure to introduce Jennifer Power, who's the acting CEO of MIFQ. MIFQ provides personalised support for people with mental health conditions, their families, friends and carers, and they've been doing so for more than 30 years. The organisation provides a raft of services, including individual carer and group support across Brisbane, Gladstone, the Gold Coast, Sunshine Coast and Toowoomba. So please welcome Jennifer.
Good morning, everyone, and I will put my reading glasses on. At the outset, if I can make acknowledgement of Trevor as the federal member for Brisbane, and equally I was relating to him that he is my personal member, and so I thank him for all of the service he does within the community and more broadly at the moment. Georgie, welcome, Beyond Blue CEO. Finally get to meet you in person, and I think you are such an embodiment of Beyond Blue as an organisation. Pauline Coffey from the PHN and Pauline's colleagues. Trevor, I'd absolutely endorse. I have never had a better gift in my professional life than to partner with the PHN, the Brisbane North PHN. It has just been an embodiment of skill and professionalism and partnership, and indeed I stand that they are an exemplar. Ivan Frakovic, welcome, and our incoming Mental Health Commissioner and a previous work colleague and obviously sector partner. So thank you very much, Ivan, for attending. And our coaches, brilliant. The day has finally come, and welcome. And more broadly, ladies and gentlemen and other sector partners, welcome. I too would like to acknowledge the traditional owners of the land, and in particular Songwoman Maruchi. We actually had an opportunity to have a bit of a chat about our shared environment of growing up on the Sunshine Coast, and I do remember a lot of the stories. But I'd probably echo what Trevor and Georgie has said. Whenever I've been in your company and you've welcomed, your spirit resonates, your voice resonates, and it is always such a pleasure. So thank you. Georgie's provided some background about MIFQ, but linked into that background, I'd also like to give an opening acknowledgement to people with a lived experience of mental illness who may be in this room, because as Georgie has indicated, our very foundation of MIFQ as a service provider arose from parents and carers and people with a lived experience advocating for improved service and system responses. So as an organisation, we never veer from honouring that legacy and why we are here to stimulate change and to partner in change. So very much today, and it's very much a shared launch, which I just think is brilliant, of the new access services builds on that foundation of seeking improved responses, and it really further builds on the intent of partnerships and relationships, and that is at our core of MIFQ, to always embody trust in those relationships. Georgie alluded to part of the story of mental illness, and the story of mental illness is one that many of us in the room are able to tell firsthand, because it doesn't discriminate. We all know the facts of 1 in 5 people will experience some form of mental illness or psychological distress. Some people experiencing mental health or concerns take steps to either achieve a diagnosis, but some also seek to just really understand symptomatology and impact. And Georgie's comments about early intervention is just so critical to try and understand what is actually happening for me, what is unfolding here, how can I respond and manage. As Georgie indicated, the public dialogue is changing and enabling people to speak openly about mental health, the value of mental health, and the impact of experiencing times of distress on self, family, and workplaces. We haven't achieved the same level of the sharing of people's narratives as we would like due to stigma, yet hope always resides, and leverage occurs and will occur with the profiling and delivering of the new access service and of the partnerships that underpin it. As Georgie alluded, we have been in a service and system response for over 30 years, and we've been committed to providing a specialised service to the people of South East Queensland living with a mental illness. We do this in their home, in their workplace and their community. And through New Access, that will be further expanded. Delivering recovery-oriented support and services that promote personal growth and encourages people to connect with their inner strengths and their community supports is part of our DNA. And through this partnership, our DNA is going to continue to be enhanced. So I think we're consistent in our message that we share a belief that recovery is an individual process. We share a belief that living well in our community is a human right for all people, and certainly MIFQ actively seeks to achieve this for people. Our strategy and our service responses are always positioned through the lens of a population health model, and that model aligns with the Commonwealth and the state government frameworks of step up and step down, and obviously then the consequent alignment for the PHN. We aspire to deliver services that improve the mental health and well-being of the community as a whole. So across the spectrum, and this is the starting point of that spectrum. I always use the phrase to colleagues in MIFQ, we are with people at times of unwellness, but we will also be with people at the early start of when a mental health concern may be presenting. So with the announcement of the commissioning process by the PHN and Pauline's team, myself and colleagues, we were absolutely passionate to really succeed and be the nominated provider of this partnership. The energy was palpable when we first were advised, and that passion was there because it aligned with our vision, and above all, it also aligned with the objects of our constitution as MIFQ, which is to really be front and centre in research and evaluation. So we really welcome that enables our constitution to be further enhanced. I really need to take the opportunity in the context of leveraging relationships. I don't think there could have been a better energy exhibited by Lucy Bairdell from Beyond Blue, and Zoe Cunningham, our regional manager. It was that energy and that connection that initiated us taking this step. So I do want to thank them both. And Julie Yeebsley, thank you. Chantel Ritchie, an absent colleague, and very much Dana, Julie, and Tabitha. Pauline and the PHN, thank you for commissioning us, because low intensity psychological services are integral to the person-centred stepped care. And I do have faith. We have a very skilled team with partnership, collaboration and performance, and with shared intent. We will partner in change with and for people, and we will create self-agency and recovery. And really, when I walked into the room before, I think collectively our banners send the shared message. So thank you. And do I invite Pauline up, Georgie, or do you? Okay, thank you.
Thank you. Look, it gives me great delight to welcome the most popular person in the room today, who carries the checkbook, but also is doing fantastic work. We've got a relationship at Beyond Blue with the 31 PHNs, and you're absolutely right, Trevor. Brisbane North is absolutely top of the pile, doing some really, really good thinking and just really getting on with the job. So it gives me great delight to welcome Pauline Coffey, who's the Executive Manager of Mental Health, Alcohol and Other Drugs at Brisbane North PHN, which provides services and support to more than 900,000 people living in the region. So welcome, Pauline.
Good morning, everybody. Look, thank you so much for giving the PHN and myself that great rap. We will take that. We will, respond to that. But also, that's only able to occur, of course, because of the wonderful staff that work at the PHN, and with this particular low intensity stuff I want to give a particular acknowledgement to Michelle Costello and to Paul Martin, but also, as has just been said, every single person who we attract and who we attract to pieces of work share that same sort of vision. So our sort of role is to just as best as we can lead that and find those people to try and manifest that in the community. So thank you. We try not to get too big ahead because this is hard work. Every time we turn around, there's something that hasn't gone so right. So that's why I'm delighted to stand here today where there is something which is real, tangible, occurring within our community. So acknowledgements, thank you very much, Trevor, for being here. I hear around the traps that you're a great advocate for Queensland and Brisbane in terms of the cut of the pie that Queensland needs to get. So thank you very much for being here. It's always lovely to see Georgie. We bump into each other periodically, so very nice for you to be here, Georgie. Once again, Jennifer Miff-Q, always very gracious and very welcoming within your organisation here. And also Ivan Frakovic, thank you very much for being here. And the sector is extremely happy and welcoming with your new position within the Commission. So you're going to soon be the next most popular. And ladies and gentlemen, so I'd also like to pay my respects to the traditional owners of the land on which we live, work, gather, play. And elders past and present. Also, thank you again to Marucci. Marucci gives her time and her presence to support these processes really frequently. And I always learn something a little more about the complexity of Aboriginal society. So I do appreciate when you take that time often for a bunch of white fellas to actually try and explain a little more to us. So thank you so much for that. And in terms of new access, so what the PHN has been, as you all know, we have responsibilities in mental health, and our objective was to commission low intensity psychological services that are person-centred and fits into this stepped care approach, this concept of stepped care approach. And so what does that mean? That means it's evidence-based, that it's a stage system, like a hierarchy of interventions. As some people had thought, you have to start at step A, do not pass go before you... It doesn't mean that. It means trying to match a service to people's need so that it's a much stronger... And so this low intensity service is for people with low to mild needs, and as Jennifer said, to hopefully prevent the onset of moderate to severe experiences. The impetus for the stepped care approach, which is the sort of policy frame, obviously came from the National Mental Health Commission. And when they did their whole sort of review and processes, I'm sure there's heaps of people in this room, that have been advocating and provided feedback over the period of time in regard to, what are some of our ongoing systemic problems and where are the barriers for access, and also where are our resources and where perhaps do our resources need to be. So as we know, that the government's response acknowledged that it was complex, inefficient and fragmented. And so that was a pretty compelling case for long-term reform. So we all deserve a little bit of credit for that. And what we're trying to do is to try and increase access and to try and realise in a regional level, what does this reform mean? Every time we change one piece, Paul often reminds me, every time we change one piece of a jigsaw sort of puzzle piece, something else over there needs to change. So it's an ever dynamic sort of environment that we work on. So Brisbane North PHN took on responsibility for new and existing Commonwealth funded mental health and suicide prevention programs on the 1st of July 2016. And so that also meant the commissioning of low intensity services across our region. So we do this through a process of trying to understand what mental health needs are within our catchment area. And then also we try and reach out and talk with people and try and figure out how to do this. So in jargon, co-design around what do we need in healthcare? What do community stakeholders want? And it's really important for us about how we go about doing this. We have responsibility, we're custodians of precious money. So it's no arbitrary decision making, but it's careful, planned approach. And so our team was involved with looking at a literature review, what's out there about low intensity, what do stakeholders say, what services do we have in the community, and we put all of that together. And then it's like, yes, we really do need this low intensity service within our region, you know, so that we can support the right people and try and do early intervention and risk relapse. It's also important around for people who are hard to reach or are vulnerable or socially disadvantaged. Like Georgie said, New Access is designed for, it doesn't, whether you've got your $80, $90, $150, you don't need that for yourself. You know, it's around trying to open access regardless of where you live. You might even be able to, you know, get access, and we'll find out a little bit after hours. Maybe when your kids have gone to kindy, maybe all of those other things that are practical real life barriers to people to being able to get the skills to self-manage. What I really like about this stuff is, for me, it's community capacity building, it's individual capacity building, and people then spread that. You know, as humans, we're pretty generous. When we figure out what works, whether people want to hear it or not, you often share the advice. So that's one of the other things that, sorry, that's me going on a rant, that motivate me in regard to why I like this particular program. Okay, so the New Access program fulfilled our brief, and it's already showing promising results. In Murrumbidgee, Riverina, as Georgie said, had been trialled over a number of different areas. Other PHN regions have had the opportunity to trial. So we were also looking at that. What's the early evidence say? Is this potentially as good as it appears? You know, and so far it certainly looks that way. It was obvious that we wanted to make this program also available in our region. So I'm pleased to say it's now to fruition. The program's up and running in our region since July 1st this year. So without anything more, congratulations, Beyond Blue, I guess, as designers and advocates and champions of MIFQ, as implementers and quality, make sure that's done in a quality type of way for bringing New Access to North Brisbane. Also, I'd just like to acknowledge people who sit in the room who work really hard on issues of mental health all the time, and the professionals who reach out to people. And we really do value and appreciate your expertise and trying to help us to achieve Brisbane North's PHN vision, which is a community where good health is available to everyone. So thank you very much.
Right, that's the last of the speakers, but we do have one special surprise for you, and I'd like to invite Tabitha, who's one of the brilliant New Access coaches here, to come up and have a chat with me. So this is Tabitha Ring, and she's already started seeing people, is that correct? And Tabitha, you were a church pastor before becoming a New Access coach. What made you want to be part of this program?
Well, I guess word in the church, there's a lot of people that would come in and they were having, mental health concerns, but I had nowhere to refer them. And it's been a big passion of mine, mental health, and keeping that in check. My own family struggle, so there's a lived experience there, so I'm very passionate about it. There was nowhere to turn. I remember having one conversation with one lady, and she was struggling with work stresses and a bit of grief, and she went to her EAP and was told, "Oh, I can only give you one session. I can't help you." And I was just sort of like, that can't be right. Where else can we go? And then when this opportunity came, I'm like, I want to be part of this. I want to be on board with this so I can actually help those people before it comes too bad. So that early intervention, I love early intervention. I think it's excellent.
We love that. Two words that are very important, as well as prevention.
Yes.
So in your experience, you've started seeing people. Why do you think this is a good option for people? What are you seeing people come to you with, and what do you think New Access is going to mean for them?
I think it's really, like, the thing that stands out when I think about it is that, it's available, it's affordable and accessible. So it's accessible, we've got face-to-face option, we've got on-the-phone options for those who have trouble, coming in face-to-face or they're very time limited. We've even got video conferencing that we can do. It's accessible, and it's available to everyone in the North Brisbane PHN catchment area. It's affordable because it's free, and a lot of people will actually put their mental health second to pay for the bills and to look after their family. So here we're giving them something here. We think your mental health is really important.
Mm. So, I mean, you've already touched on this, but this is quite different from sort of traditional mental health services.
Yes.
Is there anything else that, I mean, talk about, that. One of the things that I really love about New Access is that a lot of the services that the Commonwealth and other governments fund are completely outcome blind. You have no idea whether people are actually getting better.
Yeah.
That's different with New Access. Do you want to talk about the data and the...
Yes. So we actually, what we find is that, we track their data. We do some, questionnaires, so a bit different. But it's so that, the client themselves can see, hey, at the beginning, I was struggling, and over the time, like, hey, I'm actually getting better. And it also shows us that they're actually getting better as well. And, they find that, when we explain it to them, like, okay. And, as the weeks go on, they're like, wow, there is a change. And I think that's really encouraging.
And really important for funders too, to actually see that your investment's working. So what have you found the most rewarding? I mean, it's very early days, but is there a particular moment, or is there something that really strikes you about being a New Access coach that you're finding is bringing you joy?
I think the fact that, we have a personalised program, and we give them a workbook, and handing it to the client and going through it, this is what we're going to be doing, and you're going to be doing the homework, and it's, the look on their face was like, wow, I can take this home, and I can, and the fact, and I was explaining that, the skills you're going to learn in a 6-week block, you can transfer to any other issue that you're going to have later on down the track. And, that was like a real, you could just see the sigh of relief in them. So it was really encouraging.
Thank you. Is there anything else that you'd like to share with us?
No, I'm very excited to be part of this.
Excellent.
Thank you.
We're excited. Everyone's excited. Thank you, Tabitha. So look, that is the official conclusion of the formalities here. I believe we've got some very delicious things that might appear miraculously from somewhere. And please do stay and network and catch up with each other. It's been an absolute delight to be here today. We are so proud of this program. We know it works. We know it works for real people. It gives real people what they really want. It's actually freeing up specialist services, and we're seeing that in the New Access sites right around the country. Please know, Julie, Dana and Tabitha, that everyone in this room, and in fact everybody around the country, will be cheering you on. So we look forward to hearing your stories of success, so that at Beyond Blue we can continue to advocate to governments and others for a new way of doing things. We wish you incredibly well. Congratulations again to the partners. Thank you, Trevor, for taking time out of your day, and thank you so much, Solomon and Richie, for being here and giving us a welcome to your country. Thank you everyone for coming, and enjoy the rest of your day.